Our first presenter is Dr. Nick Thompson, the new BAPEN president, and he's going to update us on UK Malnutrition Awareness Week and some of BAPEN activities. Thank you, Nick.
Thank you very much indeed. It's just it's a pleasure and honour to be participating in this. For BAPEN, this is one of our most important events of the year. We tend to cluster everything. We had a conference last week and the malnutrition survey, which is going on this month as well. So I thought I would just highlight a couple of things which are going on in BAPEN, which might be of interest and we'd really like to raise awareness about. Next slide, please. And you know about this. You've just been Leslie's just been telling us this is really important partnership with the malnutrition task force, and we're really delighted to be doing this collaboratively. Collaboration is absolutely in the bedrock of BAPEN. It's a multi-disciplinary organisation. We've got multiple different core groups with dietitians, nurses, doctors, pharmacists, and very important, Pinters, the patient support group. You've heard just about the overarching themes of ask, look, and listen, and these are absolutely crucial. And so much of our work, if we can screen, if we can highlight and raise an issue early, we know that the intervention is likely to be more effective, to be easier, and also cheaper. So absolutely, malnutrition is everyone's business. There is no group who can say, oh, it's someone else is going to be doing that. The danger of that is that we fail to recognise the issue, and that's for doctors, for nurses, for dietitians, for all of us, and in the community with carers, etc. So if you're concerned, please flag this up, and then the response is going to be multidisciplinary, and who gets involved completely depends on the individual and what's going on and the setting. So next slide, please. You'll know all about we're in the middle of UK MAW, and we've been through Monday and Tuesday. So today is very much a focus on education and these fantastic events going through. I was wearing my best suit at the conference last week, and what I wanted to highlight was that in our screening survey last year, and I'll come to it in a bit more detail, is that malnutrition was common, and it appears to be becoming more common, not less common, and that's in hospitals, in care homes, in the community, in people's homes. And even when patients are highlighted, and this was particularly in hospitals, at high risk of malnutrition, only 73% of the time did patients have a nutrition care plan. So this is a call to all of us to highlight, and then we need to take action. If you screen and you don't do anything about it, I don't think anyone has been helped. So it really is a call to action, and I'll give a few more figures about that in a minute. Tomorrow, emphasis on hydration, which is really important, and then Friday, what can we do? And if you're into social media, that's the hashtag to look out for. So next slide, please. This is, if you're not involved, this survey is going on all this month. There's a QR code. Please do download that. We absolutely want as many individuals to be screened and to be involved in this. Please do get involved. We can only improve things and we can only agitate and lobby for the issue of malnutrition if we have good data. Aster McKinley, one of our previous president of the BSG, made a quote, and I'm not quite sure where it's from, said, "In God we trust, for the rest bring data." And we need information, and that's how we're going to lobby, and we have been lobbying, and I'll just mention about that in a moment. So this survey is across the healthcare spectrum, hospitals, community hospitals, homes, care homes. Please do get involved. This is really a plea to get involved and get as many people screened as possible. Next slide, please. So last year we screened about 2,250, and these were adults, not involving children. Most of those were in hospitals, but across the community settings, and this was UK and Ireland. It would be great if we could get that significantly higher. The greater the number, the more confident we can be that they are representative. With smaller numbers, even though 2,000 sounds great, then, as a proportion of the hospital population, it's tiny. So if we can get more involved, it can be more representative. That really makes a difference. We found that 48% were at a risk of malnutrition, and 36%, over a third of all our patients being screened, had high risk of malnutrition. And it was really across the board, but it was actually highest in patients in their homes. Now, of course, was that a representative group? Probably not. But does it mean that there's a huge issue out in the community? Absolutely. We know that most malnourished people in the UK are not in a hospital. That's a high concentration. The same is true of care homes, but most patients with malnutrition are not in a care home and are not in a hospital. In hospitals, 47% had evidence of risk of malnutrition. And it depended on, a wide spectrum. So GI disease, cardiovascular disease, patients having cancer therapies, all of them. There wasn't a group where we found there was a low risk of malnutrition. And this, rather worryingly, is that a nutrition care plan was only in place for a small majority of the individuals, and those who are at high risk, where we would really be wanting those individuals where it's been picked up that we have a care plan that only 73% had. So we can and must do better, but that means that hospitals and care homes, they need the resources. Community settings need the resources to be able to take action. Next slide, please. I thought I'd just flag up a couple of things that BAPEN's been doing, which might be of interest. As Leslie said, we've had a change in government, and so we have taken this opportunity. We submitted to the Darzi report. We were allowed to, in the Darzi report, you were allowed five slides with data, so a table or a graph. And we wanted to highlight that that exacerbations of other conditions are made worse, are associated with malnutrition and are made worse by malnutrition, that screening still wasn't occurring universally, and that's despite NICE guidance, that there is a very significant cost associated with malnutrition. And we are offering to those who allocate resources, to politicians, to policymakers, that we can be part of the solution, because money is tight, and we hear that, and black holes and etc. Actually, addressing malnutrition improves care and saves money. Well, there aren't many treatment options. The fanciest, newest oncological drug or whatever therapy it is often costs significantly more for healthcare gains. We actually have got the win-win, is that we can improve care, we can improve people's health but we can actually save money and save resources for the NHS. On the back of that, we've written to the health ministers in the United Kingdom and across the United Kingdom. And in Northern Ireland, I'm pleased that we're going to be meeting jointly with the BDA, the British Dietetic Association, and Patients Support Group with Mike Nesbitt. We're meeting next month to draw attention to malnutrition. We've got half an hour of his time to plug as much as we can and to emphasise the importance of this. And we're going to be involved, and I'd encourage all and everyone to submit about the 10-year plan for the NHS. That engagement process is now open. Do get involved. Do mention malnutrition. Thank you. And so, next slide. A couple of other things just to flag up for you. We want to, for in hospitals, and this is taking a hospital-centric view just at this point, if we want to improve nutritional standards, if we want to improve nutritional care, it's all about teams and getting multidisciplinary teams together and working. And we're going to have a 3-day course. It's going to be in May. It's going to be in Edgbaston. And this is for nutrition teams to come together for some shared learning and to develop as a team. So some of it will be some technical stuff about nutrition and nutritional knowledge, but also about a third of the time it's going to be about team development and team effectiveness. So if you're involved, if you're in a hospital, you want to get involved, please do look out on the BAPEN website. We're going to be advertising how you're going to apply and applications by the end of January. If you're not sure, just please do send a message to BAPEN saying, expressing an interest, and we'll make sure you get an application form. The application form is going to be brief. It's paid for by BAPEN other than your accommodation costs. Next slide, please. Just 2 more quick things. I just thought you might be interested in some of the projects we're funding through BAPEN, through our core groups. So developing and updating competencies for dietitians and pharmacists, particularly in sort of more specialised areas in nutrition like intestinal failure. We want to improve the inclusivity of our information on the website and that we produce. We make a lot of effort to try and make this as inclusive as possible, but it can always be better, and we're going to have a project to do that. BAPEN Scotland are going to be developing some short videos, 5 to 10 minutes, about different aspects of nutrition. And we're going to we want to enhance our ability to perform clinical research across BAPEN. We've got some specific projects looking at improving liver nutrition in patients with advanced liver disease, and that's in Birmingham, and looking at a specific targeted tool for those who are experiencing homelessness, and that's a London project. And then last slide. And finally, we are wanting to make sure that we both have a national presence. We've got the website, but we want to develop a regional structure. So if you are involved in a hospital and you would like to, hospital or community, and you want to get involved in your region, please do let us know, send us an email. And we've got different parts of the UK, different nations in the UK and within England, split down to regions. And we absolutely want to use this because delivering learning and teaching regionally is often much more convenient. We want every region to have at least 1 learning event a year. And also we need workforce data so that, again, we can go, we can lobby, we can knock on doors, we can be a nuisance and say, these hospitals don't have nutrition teams, they need help and they need resource to improve care. So just a few things about what BAPEN's doing. I hope that's of some interest, and please do get involved. And if you've got any questions, please get in contact. Thank you.